Joint disease is usually evident by swelling and the inability to move that joint, symptoms that prompt a person to consult a doctor. But often only the subjective or objective symptoms are not enough to clarify the cause of the disease or indicate the treatment to be followed. Since there are many forms of acute or chronic diseases of the joints, only medical analyses can distinguish between these diseases. Joint diseases are due to the inflammation of the soft parts around them, like ligaments, capsule, cartilages, and synovium. And very rarely in the chronic phase, they also affect the bones, processes that can be highlighted by radiological examination. These diseases, as will be seen, affect the whole body, but the patient notices them at the place of suffering, that is, at the joints. Most diseases of the joints are rheumatic diseases, whether acute or chronic, and others are of an infectious nature, such as arthritis with or without purulent fluid in the joint. Acute polyarticular rheumatism refers only to acute attacks of suffering that are often interspersed with subacute states or periods of apparent healing. The disease is more common in young children and adolescents between 5 to 15 years of age, and in most cases it starts suddenly. Usually the condition appears after 1 or 2 weeks after a throat infection like pharyngitis or tonsillitis, or after scarlet fever or other acute or unnoticed infection with beta hemolytic streptococcus. But in addition to the streptococcal infection, the allergic factor also intervenes, as well as the body's defense power. The cold season, with cold and humidity, crowds of children in kindergartens and schools favor throat infections and the transmission of streptococcus.
The disease can affect other organs at the same time or in turn: the heart, the kidneys, the digestive system, the respiratory system, and so on. The main symptom is inflammation of the joints, which moves successively from one joint to another. Redness, swelling, and strong spontaneous pain, or at the slightest movement, are found at the site of inflammation. The joints most affected are the knee, the ankle, the shoulder, the wrists, and even the fingers.
Often the joint is filled with a fluid. Joint signs are accompanied by fever, pallor, sweating, fatigue, weakness, palpitations, and other cardiac signs, including the presence of enlarged nodes on the sides of the neck. The disease improves after treatment with antibiotics and anti-rheumatic drugs. Rheumatic attacks can be repeated and become chronic, especially if the streptococcus persists in the body and the penicillin treatment is not done correctly.
It is more correctly called chronic progressive polyarthritis or rheumatoid polyarthritis. The disease occurs in adulthood 3 to 4 times more often in women than in men, and affects, in addition to the joints, other organs and tissues. It has a chronic and progressive evolution, and at one stage the affected joints deform, causing temporary or permanent infirmities. Ankylosing spondylitis is a chronic rheumatic disease of the spine, which eventually leads to ankylosis or stiffness of the spinal cord. It typically begins at a young age, between 20 and 30 years, and is more common in men than in women. The causes of the disease are not sufficiently known, but are suspected to include acute and chronic infections of the mouth, teeth, sinuses, gonococcal infection, injuries and curvature of the spine axis, often related to professional activities, and changes in the function of some endocrine glands, like the adrenal glands. The disease evolves over decades. The initial symptoms are subtle and often go unreported by the patient, who could benefit more quickly from treatment. Back pain at different levels of the spine, especially at night, can cause insomnia. The pain worsens with movement, particularly when bending. Other signs can include low-grade fever, fatigue, and weakness. Over time, the spine loses its elasticity and becomes rigid and stiff. The patient may adopt a bent position with the chin on the chest. The pain intensifies and breathing, especially inspiration, becomes difficult. In an advanced phase, which can last several years, ankylosis of the spine occurs through ossification. The patient can no longer move, becomes an invalid, and is bedridden. The erythrocyte sedimentation rate is increased, especially during acute periods. Neutrophil white blood cells often have increased values, and red blood cells may indicate anemia. Destructive degenerative lesions of the spinal joints are called spondylosis. This disease occurs in elderly people. typically over 40 to 50 years old. Besides the aging process of the spine, other causes contribute to the disease, such as small and moderate but repeated traumas of the spine over decades. These can result from carrying weights on the head, shoulders, and back, or from physical activities that require constant bending or incorrect spinal positions during work. Backward or lateral curves of the spine can also play a role. These causes act over many years before subjective symptoms like pain and objective symptoms like radiological changes with the formation of beaks appear. Usually spondylosis is localized to one part of the spine, cervical, dorsal, or lumbar, where the most significant movements occur. It rarely affects the whole spine. Arthritis and arthrosis are acute or chronic conditions of a joint, often infectious in nature, that affect the synovium, the inner lining of the joint. They are characterized by swelling, pain, redness, warmth of the joint, and often a collection of fluid. This fluid may be yellowish or purulent if it contains microbes. In some cases, arthritis is accompanied by fever. Arthritis can also have non-infectious causes, such as allergy, gout, or trauma. Medical analyses show an increased sedimentation rate, leukocytosis, and the causative microbe can be isolated from the synovial fluid.
Treatment of arthritis depends on its cause. Calming agents like aspirin, Fascanol, and phenylbutazone are commonly used. Additionally, local rubbings with Salirom and Galenica can be beneficial.